I'm Brandon Fisher, Radiation Oncology with Gamma West Cancer Services. About 70% of the patients we see in radiation oncology we treat with curative intent, meaning we treat them to kill the cancer and never hear from it again. And 70% is a lot. So you see these patients, they're very vulnerable patients, very scared. They have a diagnosis of cancer which potentially could kill them. And they come in there relying a lot on the physician to use his expertise and knowledge to get them through that. And in radiation oncology, we have such advanced technology nowadays that we can pinpoint a tumor. Say they have a 2-centimeter lung tumor, disease that if left untreated for a year or two would kill them. We could pinpoint that 2-centimeter lung tumor. We can put about a 5 to 10 millimeter margin around that, hit it with such degree of accuracy that their lung function tests don't even drop and that the cancer becomes completely eliminated. And I saw that over and over again where patients were diagnosed super scared of what they had and then come out the other end a completely changed person, cancer-free. But during that process of it, encountering such a huge obstacle in life, these patients became such a great inspiration to their family, friends, but also their physician. So I'm kind of a unique cancer doctor in that I treat basically every single cancer out there. I don't necessarily have an expertise in just brain tumors or lung tumors or breast cancer, but I feel like I'm well-rounded and treat basically any type of cancer that comes through the door. I'm willing to treat and feel like I have the knowledge to address that. One thing unique about what we do here is we have great radiation machines. We basically have every technology ever invented. We have a great external beam radiation machine called the TomoTherapy unit. We also have a more traditional radiation machine called a Varian linear accelerator. We also have brachytherapy, and we also can do other types of radiation such as radioactive iodine and other treatments like that. And so we do see a lot of lung cancer, a lot of breast cancer, prostate cancer, you name it. We have the ability to treat it. The most common cancer out there is breast cancer. There's 220,000 cases of breast cancer a year, and we have great technology to treat breast cancer. I love treating breast cancer on the TomoTherapy radiation machine. What it does different than traditional radiation machines, rather than just using 2 beam angles, it uses hundreds of different beam angles and hundreds of little pencil beams. And when you do the planning for radiation, often radiation planning looks pretty basic. You see these 2 beam angles come across the person, and you try to arrange those beams so that they cause the least amount of toxicity while still hitting the region you want to treat. However, TomoTherapy, it actually looks like you're actually bending the beam. The beam comes at the person with all these different angles, and it can configure a dose that's very homogeneous, a very fluid, equal dose that actually looks like it's bending off the heart and lungs, which really limits toxicity and makes the treatment much easier to get through. Also, in using so many different beam angles and making a more fluid dose, we eliminate a lot of the hot spots in areas that used to cause bad burns and blisters. And sometimes when you talk to people who've had radiation in the past, might say, "Oh, it looked like my skin was going to fall off." But on TomoTherapy, we don't necessarily see this. We see patients really get through the treatment quite well, which is great because it makes our job a lot easier, not having to manage all these side effects, but it makes their life much easier because they don't have to deal with those side effects. So that's something unique we have here. Initial evaluation, we'll figure out where this tumor is in the person's body. Usually we'll use some type of imaging, CAT scan, MRI, PET scan. There's so many imaging modalities out there that really allow us to focus in on what this tumor looks like, where it is, and how it has grown in nature. Has it metastasized? Has it spread outside its origin? So we really rely on imaging initially to figure out where this tumor is. And then we take all this imaging technology and we apply it to the patient. So the patient then comes in for what we call a radiation simulation. We lie them on this table and we get them in a position that we can easily recreate every day. The way we do that is we put them in this beanbag-like thing that molds around their body. We suck all the air out of it. It makes a complete body mold of them. We then line them up to laser beams, which we put a couple tattoo marks on their body, which line up to these laser beams, and then we do a CAT scan image of them in this position. Then we take all that imaging that we've had done prior, the PET scan, MRI, this CAT scan we just obtained, and we ship it to a special computer where we do all the radiation planning. We define this tumor and we figure out how we're going to get radiation beams into that tumor. to such a dose that we can cure this cancer while sparing the normal structures. And with advanced technologies, for instance, we're treated on a TomoTherapy unit here. TomoTherapy has the capability of doing things like radiosurgery, stereotactic body radiation, which uses just pinpoint radiation to hit a target. So we'll figure out all these different radiation beam angles, how to hit this tumor and spare heart and lung toxicities. If the tumor is up against the bladder, we'll try to spare the bladder and the rectal area. And that's where it becomes really interesting. We're seeing all these different beam angles, and then we calculate out dose and risks and figure out how to give them the best treatment. Once we approve a radiation plan, the next step is we send it to our physicist. The physicist's job is to make sure that what we saw on the computer and what we planned out can really be done in real life. And so he creates this phantom-like object, so it's a patient. They create this phantom of the patient, and then they repeat that radiation plan inside this phantom, and then calculate all the doses, and then in the end they give their final approval and say, yeah, what you planned on the computer is exactly what's happening in real life. And once it passes our physicist, then we bring the patient in for their actual treatments. And radiation treatments can be anywhere from 1 to 40 treatments. And kind of depending on where the tumor is. If it's in the brain, we can do radiosurgery, which is just a one-shot huge radiation dose, which basically just carves the tumor out of the brain. If it's the lung, oftentimes it could be anywhere from 5 to 30 treatments. A prostate, anywhere from 5 to 40. And it kind of just depends on where it is in the body, but every patient's different and every scenario is different, and no two tumors are exactly the same. So one unique thing we have to treat breast cancer is brachytherapy. Brachytherapy, what it does different than traditional breast cancer treatments is traditional breast cancer treatments are anywhere from 4 to 6 weeks of external radiation, where an external radiation beam will hit the breast, rotate around the breast, and just treat that area. Usually there's a fair amount of skin toxicity, but a little bit of heart and lung do get irradiated with this external type of radiation. The external radiation doesn't start till about a month after your surgery for breast cancer, and then it goes for another 4 to 6 weeks. So you're talking 2.5 months of therapy after surgery before you finish radiation. Now, brachytherapy, on the other hand, you typically start the brachytherapy 1 week after the surgery, and then the brachytherapy only goes 5 days, and so 2 weeks after the surgery you can be done completely with all your radiation treatments rather than 2.5 months. What the brachytherapy also does difference, brachytherapy means close treatment. And for breast cancer, the areas at risk that require radiation after surgery are just the surgical bed. In most cases. There are other more advanced cases where you have to treat a larger area, but for some women who can be candidates for breast brachytherapy, we only need to treat a rim of tissue around where the surgery was done. And so what we'll do is we'll implant a brachytherapy catheter into that surgical cavity, and then we'll place a radioactive pellet down that catheter. It will dwell inside that cavity for a couple minutes and then retract back out. We'll do this for a total of 5 days, and after the 5th day we'll remove the catheter, and the treatments will be done. An appropriate dose would have been given to that surgical bed to sterilize it and prevent any recurrences. So, and for women who are early stage breast cancer or non-invasive breast cancer, brachytherapy is a great option, allowing what used to be 2.5 months before they got through the radiation treatment is now just 2 weeks. Pretty amazing. So the type of breast brachytherapy we use is a device called the Savvy. The Savvy is for strut adjusted volume implant. It basically looks like a little whisk that is placed in the surgical cavity. We place it using ultrasound. We'll ultrasound, find where the surgical cavity is, and then place that device right inside that surgical cavity. Once the device is in there, it expands, fills up the cavity, and then we can place radioactive pellets down each catheter, which dwell for about a couple minutes down each catheter, and then retract back into this robot-like device called a high-dose rate brachytherapy machine. And the patients I see on a daily basis, being their physician, they take me to a place that's super sacred, so to say, to them. It's really vulnerable to them. They take me to their cancer diagnosis. They're really scared, they get emotional, they cry, and it's something that they'd rather not do. However, they take me there with them, and I see this go on in their life. And so I try to take them to something that's personal to me. To kind of say, hey, you know what, I care about you, and you shared something so deeply personal to me. This is something deeply personal in my life that I wanted to share with them. So on each of these climbs, I'll take a flag in honor of my patients to the top of these mountains. I'll hold it up high at the top of that mountain, think of them as I put forth all this effort to get there, wave that flag high, knowing that they put forth a much greater effort getting through cancer treatments than I could ever put forth in climbing a mountain. And we wave that flag high, and I try to get some video and pictures of that to share with them when they get back. And usually when I share it with the patients, I think it becomes a very touching moment for both of us. At that moment, we both have entered in something very personal in both of our lives, and it allows for a connection that's greater than anything anyone could ever experience. That's one reason why I love being a physician, is just going full circle with life, from a hobby to a daily activity of helping patients. It's all one big circle. If someone comes to me recently diagnosed, usually I tell them, don't believe everything you hear out there. Every patient's different, every statistic's different, individualized care just for them. And I'll look over everything in the stage, and then we'll really approach it with a very optimistic view. I never tell people to throw in the towel. Life's always worth fighting for, and we can always get a good outcome. And I always think, our well-being isn't necessarily how healthy we are or if we beat cancer or not. Our well-being is a product of meaning that we create. And if you could find a way to create meaning despite having the diagnosis of cancer, then life is meaningful. And so we try to find meaning in everything, and then we'll go on and attack the cancer and give it our best and hopefully have a good outcome. But having a good outcome is a lot about making that a meaningful relationship and having a meaningful life.
Gamma West, taking cancer personally.